there's a couple things to keep in mind. So we have kind of what we call counseling and clinical psychology. So counseling psychology are things like marital issues, mild depression, career choices. And that kind of falls in the counseling realm. And we have like marriage and family therapists, and they're great at those sort of things. And that's what they're actually trained to do. On the other hand, we have clinicians. So we do clinical psychology. So that's what we do. So when we can come up with a diagnosis, now we're talking about a different ballgame. So if we're having like kind of an acute short-term level of worry, something like, oh my gosh, the test is coming up, or I'm going to the prom and it's with my big crush and I don't know how to do this. Those sort of things are kind of common, and everyone experiences those things. And that's something where like mom and dad can step in, or even if it's an ongoing issue but relatively short, like a semester, that might be something for like a counselor, like a marriage and family therapist to help out with. There's some good workbooks, so there's some self-directed ways that we can help with those kind of short term. But if we see this as a pattern, every single time I go out on a date, or every time I have a test, or every time I have to interact with my colleagues at work, now we're starting to have a level of interference which is significantly different. And it's no longer kind of a counseling one-off thing. It's an ongoing problem that now we might have to do something with a clinician. So we talk about clinicians, then we're also looking for, unfortunately, the field of psychology is really fractured. There's all sorts of different theoretical backgrounds and understandings of how we approach issues. We tend to be very research-based. So we're looking for what the research tells us works. So it's called empirically supported treatment protocols. And the idea is, does the empirical evidence indicate that this is the way that treatment works? So what we know for anxiety and OCD disorders, the primary form of this is called cognitive behavioral therapy, or CBT. So when we look at cognitive behavioral therapy, it's cognitive, so we're changing cognition, behavioral, changing behaviors. Okay, so we're actually working on changing how I think and how I behave. And to do that, we actually focus on, once we understand that it's logically okay to do, then we actually go out and practice doing those things. So rather than trying to avoid dogs for the rest of our lives, we might start by we have one person who couldn't even say the word dog. So we start saying the word dog over and over and over again. Then we start looking at drawings of dogs. Then we start looking at pictures of puppies, to adult dogs, to dogs that look aggressive, to looping tapes of dog attacks, and have them watch that and get used to it. So when they have that thought in their mind, it no longer overwhelms them because they've already kind of seen it, to bringing dogs into session, to actually going to dog parks. The idea is, rather than moving away from our feared objects, is if we understand they're actually safe, we move into that anxiety and normalize it and start to recognize, I'm uncomfortable, I don't like this, and I'm totally okay. Kind of like going through a haunted house or watching a horror film. I don't like horror films. They scare me. But I'm not in danger. I'm not going to die from watching a horror film. Am I going to be scared? Absolutely. If I have good reason to go, so let's say my wife really loves horror films and I want to spend time with her, and that's her choice of what she wants to do, luckily it's not, then I would go. Why? Because it would be worth it to support my wife. Am I going to enjoy it? Absolutely not. Right? But we're learning to get comfortable being uncomfortable.